Hello, my name is Dr. Gulani. I'm a board-certified optometrist and have been so for about 26 years. Back in the late 80s, early 90s, I was wearing those very thick eyeglasses and because I couldn't wear hard contact lens anymore due to high astigmatism. My tears had dried up. Consequently, I began to look to see what was the available refractive surgery at the time. At that time, it was the best of radial keratotomy or the beginning of LASIK, PRK. My prescription was in the neighborhood of 3 diopters myopia with 3 diopters ptericity in both eyes. So I had RK done on my left eye. Consequently, after it had settled, my vision actually was worse. My daytime vision was in the neighborhood of 20/30, and my nighttime vision was in the neighborhood of 20/60 with no depth perception. Radial keratotomy is like cutting a pie with 8 slices, but sparing the center. And on the upper and lower aspects, I had a horizontal or T-cut. This was to help to reduce the amount of astigmatism on the front of the eye. Well, that left as you could imagine, it left the cornea uneven with lots of distortion. And my nighttime vision suffered from this distortion as I couldn't judge cars whether they were close or far. I had a lot of scattering light, like sort of looking through a Coke bottle where the vision was distorted. So I was basically only using one eye at night. And this is not the way the human system is designed. It's designed to have both eyes working pretty evenly. I struggled with this vision for nearly 15 or 16 years until I met Dr. Gulani. All previous ophthalmologists could not guarantee that the cornea could be fixed or the scars could be reduced such that I could get my stereo vision and my vision in order. Consequently, discussing with Dr. Gulani, he was able to explain to me that with new technology that he had developed, there was a possibility of me being restored to proper sight. And we went forward in that direction. He uses several different techniques on the cornea to get the desired visual acuity and depth perception. In my case, when I was done, my vision in the daytime had improved to 20/30 plus, and at night my vision was now in the 20/30 range and my depth perception had returned. He was able to use 2 different types of technologies to combine them to get the desired result in my particular case. The first was the taking away of the top layer of the eye called the epithelium. And then once that was there, he took another laser that basically smoothed out and reduced the scarring on the top part of the cornea. After that was done with the laser, time was given to allow the top layer cells, the epithelium, to resurface the front, much like you would resurface the pavement of a road, and allow that to heal. And my vision was restored. I was able to get depth perception, day and night vision. That's totally acceptable. A little discussion of the difference between the previous technology, which is RK, and corneoplastique. RK surgery required 16 cuts and 2 T-cuts to give the desired reduction in myopia and astigmatism in my particular case. Consequently, it left scarring, and it was done a little bit too close to the cornea, so as my pupil dilated, the scarring actually diminished my depth perception, especially at night. It also left irregularly shaped cornea as well as high spots and low spots and all those difficult things that most of you see. And there are millions, hundreds of thousands and millions of patients available who are suffering with poor night vision and poor depth perception from this particular surgery that was prevalent in the past. Corneoplastique is actually using combinations of different technologies to get the desired effect. In other words, it's just not one procedure to get you to where you're going, but it's using the best of both techniques to give the best visual acuity. And Dr. Gulani has mastered all of those, and he uses them to get the desired results. In my particular case, use the laser ASA to resurface the damaged layer of the cornea, get rid of some of the scarring, and make a more regular formation of the corneal surface and allow the epithelium to heal and resurface the front. Basically, he repaved the front of my eye, much like you would blacktop on the road. As I mentioned earlier, my vision had improved to the point where I now had stereopsis at day as well as good depth perception at night. And this is the wonderful technology that Dr. Gulani brings to the forefront.
So Jay, what was your experience like with the surgical advanced laser technique to correct your RK?
Well, in my particular case, when I had RK, it was immediately I knew that the vision was less than what I wanted or expected. And I suffered with it for about 12 years, and every year I would go to a different ophthalmologist to see if it could be improved, and every year I got the same answer. No, we don't have the technology. No, it can't be improved. When I started to hear, yes, maybe we could try, it was, well, we really can't guarantee the results. You may stay nearsighted, you may stay farsighted. So none of these options gave me any confidence that I wanted to try to fix this, and that basically I kept hearing it was not fixable. When I went to your lecture at one of the educations for eye doctors, and you talked about corneoplastique, which is using the right tool or combination of tools to fix your visual problem, as opposed to all the other doctors saying that I have one technique and I'm not sure this one technique is really going to work on you and I can't guarantee it. So when I heard your corneoplastique concept, it made perfect sense to me. After our conversation together, I felt confident that there was hope, and we both went forward on this, and now I have basically normal vision again. Both eyes are working approximately equally, and I have my night vision, my depth perception. I'm very happy. It's a world of difference. I basically came from normal vision, went through surgery, had abnormal surgery with the old technology, and you restored my vision back to normal.
Well, thank you. It's been a privilege, Jay, to be able to do that. I have seen this with numerous patients who come here where they've had radial keratotomy and they feel that there is no hope. In fact, if you look at the whole system of your eye like a camera, you can even do cataract surgery for these patients if they are at a certain age where the cataract's an issue. And again, correct them from inside out. Do the cataract surgery with an advanced lens, come outside and do advanced laser on the cornea. So to fix it up, in your case you didn't need cataract, and I could just with the laser go and shape you up, increase your optical zone, decrease the irregularities. So it's truly something that I'm so pleased with as results with previous RK.
You're pleased. Imagine how pleased I am. I can see again.
Excellent, thank you.